Good afternoon, and welcome to today's Inclusion Works Community Advisory Committee meeting. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet, and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you're speaking or asking questions. To ask questions, use the Q&A feature located on your control panel, and we will answer as many questions as time allows toward the end of the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Callie Marsh. For closed captioning options, select the closed captioning feature located on your control panel. To adjust your video layout in screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics includes a review of the advisory committee details, an overview of the Inclusion Work Strategic Plan, a discussion on employment assessments and CIE liaisons. This will be followed by a Work Together NC update, Provider Innovation Program, and WISE Online Academy, and Inclusion Works training opportunities and resources. There will also be time for questions after the presentation. At this time, I'd like to turn it over to Claire Colligan, IDD Employment Lead for the IDD, TBI, and OMSED section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services. I'm sorry, Claire, you're on mute.
Thank you. I apologize. I'm really happy to welcome everyone here today to our Inclusion Works quarterly community meeting. We have lots to share with you, and we want to make sure we have time for your questions. Next slide, please. And so for today, I just want to make sure you're aware of all of the folks here who are here working with this team to make sure we give you all the information that you need to do the work that you do. So you know me, I am the IDD employment lead for the IDD TBI and OMSED team here at DMHCDSUS. We also have with us today, we're very lucky to have Catherine Titus. She is the Senior Technical Assistance and Training Manager for the WISE group. Anita McMahon from EIPD is here to help us out with explaining all of the work that we're doing in collaboration between the divisions of DHHS. And finally, but not last, is Yolanda Perkins, and she is part of the Work Together NC team, and she is a tremendous help and a tremendous part of this collaboration that we have in advancing employment across the state for people with IDD. Next slide. So I want to just remind us all about the reason that we're all here today and why we're so happy to see so many of you join to talk about the community meeting, the way we're set up and what our purpose is. Next slide. And this is, again, mostly what we really want to do is make sure that people who are involved in these issues and helping us with this work have chances to share their own experiences, to make sure that people know what is available to them, to give advocates and family members, providers, and people with lived experience chance to air their thoughts and perspectives and opinions, to tell us what they need, and then we will share as much as we can about what we're doing to try to meet those needs. And as we ask also for your feedback, one of the things I love about working with this group of people is that we always get the opportunity to hear about, yes, the things that are working and the great success stories, and also what we need to work harder on. And we're always willing to do that. Next slide. So just another reminder that these meetings happen every 3 months. The next ones will be in July and October. And we continue to update this based on the feedback, the input that I get, that we all get from you. We do have surveys at the end of this where we would ask you to tell us what you want to see as topics for these meetings. And I encourage everyone to let us know how we're doing and to give us feedback on how we can continue to grow and manage this meeting so that it works for everybody. Um, don't hesitate to reach out and ask me questions. Get in touch with me. This happens a lot. I talk to a lot of people as a result of people who come to this meeting, and it matters a lot. You help us drive the agenda. So don't ever hesitate to reach out to me if I can be helpful in any way. Next slide. Okay, so first off, I want to talk about some of the exciting work that we're doing here in the program. We have a lot of work happening in this space. Right now, I'm excited. We're going to talk later, and Catherine Titus is here from WISE to talk to us as well about our latest updates on the Provider Innovation Grant. Those who are currently working on the grant and those who are in the application process. So we're really excited about that. We have a new video, which is available on the DHHS YouTube site. There'll be a link to that later on. And we also are closing out the month of April, which was Autism Acceptance Month. I think it's Autism Awareness Month, probably typo there. And we had a great lunch and learn with Mike Chapman on April 15th, where he talked about employment and autism. And we have that recording available to anybody who wasn't able to attend in person. And we have a brand new social media campaign that the design team with Work Together and See created, and it's very exciting. And they're going to be weekly updates to the social media presentations that we have out there. Next slide. So as always, we start with the strategic plan. It has been, and you can go right to the next slide, thanks. It has been more than 6 months. I want to say we're headed into the 9th month right now since we released the strategic plan last year, and we are working tirelessly on this. This has become the focus. Everything that we do brings us back to the strategic plan. The strategic plan, as a reminder, was formed with the input of many, many different stakeholders in the community, and that drove the discussion and that drove the way we set our goals. And I'm just going to give you a little reminder of those in a second. And so come August, we will be looking at releasing a first year summary of how we've done so far, where we've been able to focus our efforts, and what our plans are for the year coming up. Next slide. So just as a reminder, I know you've probably seen this many, many times, but I do like to just remind people of the goals and how everything drives us back. The number one goal, and we focus on this a lot, as I said before, we have a new video focused on the informed choice goal. And the informed choice goal was based on the feedback that we got from people in the community who said that people with intellectual and developmental disabilities need to be able to have choices. They don't need us to tell them where, who, why, or any of the things about where they should work. They need to be able to have the accurate information so they can make their own decisions. So informed choice provides people with intellectual and developmental disabilities the opportunity to pursue competitive integrated inclusion employment if that's their choice. And we want to make sure that they have a standardized, acceptable way for them to let us know what their choice is that works for them. Number two is, where are the services? What do they look like? Where are they meeting needs? What do we need to do differently? And so quality IDD services, we're focusing on expanding and improving service options for people with IDD to help reach their employment goals. Number three, community outreach. Can't say enough about that. That's part of the reason we're all here today, right? We need to make sure that we maintain proactive communication and engagement with all community partners to provide accessible information about CIE options and resources. Number four, we want to make sure that the workforce continues, and we work together with a lot of different people here to work on making sure the workforce is vital, robust. I'm going to talk briefly a little later on about Inclusion Connects. And Inclusion Connects, if you didn't have a chance to go to their meeting the other day, I'm pretty sure there's a recording of that. They're doing a tremendous amount of work on the workforce, making sure we have qualified people ready to deliver services to the folks with IDD that we serve. We want to make sure that staff have the capability and support tools to enhance service delivery. And lastly, but not leastly, promoting an increase in employment opportunities through building employer capacity. How are we helping the people who are hiring people with disabilities? And we've been doing a lot of work in this space as well, and we will continue to do so. Next slide. So the strategic plan, as the strategic plan was developed, we organize it as such that we have these goals that I've just discussed, and then those goals are broken down into the objectives. How do we meet the goals? What are the things that need to happen? And then the strategies to meet those objectives, right? What are the individual things, the tasks that people are going to do to go forward so that everything is in place for those goals to become reality? We have a work plan that is robust. I've used that word a few times already. It is very comprehensive. We add to it, change it, complete things, and get to remove them on a regular basis. It is something that is a really important living document of how we are managing the work that we're trying to do to make sure that we're using our time efficiently, and also to make sure that we are flexible enough to move things as they need to be moved so that we can actually achieve the goals in a way that matters to the people that we're trying to help. So at this point, I want to turn it over to my colleague, Yolanda Perkins. Yolanda and the Work Together NC team has been, I can't say enough about the improvements in their system and how they have worked tirelessly to change the way we were accomplishing the employment assessments, the outreach that they've been doing, and the success that we're having. So I'm going to hand it over to you, Yolanda, and you can tell us all what's been happening lately.
Thank you so much, Claire. And I want to say that, we've been honored as part of the Work Together NC team to work with the state on this project. The Work Together NC team is led by Dr. Brianne Tomaszewski, and she has been helping us put this process in place. So one of the things, as Claire mentioned, are the employment assessments. And those employment assessments were put in place to really start that process of informed choice, ensuring that individuals with IDD can share what their interests are, what their strengths are, and what it is that they would like to do with next steps for employment. So as part of that, we have had the opportunity to work with 15 providers across the state. They have been instrumental in helping us get these scheduled, collecting the consent form. So I want to give a shout out to all of those providers that have worked with us to get these assessments done. As of March 31st, we have completed 143 employment assessments with individuals with IDD. So we've had the opportunity to go out to those provider sites, work directly with the individuals, asking them the questions of what it is that they are interested in doing and learning more about them. We also have had the opportunity to complete 57 family guardian employment assessments, because not only do we reach out to the individuals with IDD, but we also want to hear from their family members and guardians to hear about, to get a better idea of a whole picture. What do they see as strengths? Where supports are needed? So along with that, we're able to take this information and then share that with DHHS for next steps. And you're going to hear a little bit more about those next steps as when Anita speaks today. Okay. So I just wanted to share with you, as I mentioned, that shout out to the providers. So on our next slide, if you go there, we also we want to let people know, if you're a provider and you have not yet had those employment assessments done, please let us know as you are interested in doing those, because we're here to support. And we just wanted to share one of the quotes that we received from a provider. So we wanted to thank them very much. We do want to let you know that when we do the employment assessments, we do those on the provider schedule and what works best for the individual with IDD. And so really we're there to make the process as smooth as possible. So this quote really just really touched our hearts. And I want to thank the providers as they share these out. So this is an example of some of the feedback we get. They felt that as we came in, we were able to ensure those assessments were completed and that we were able to provide them with the support of ensuring that all the participants would be able that consented and were interested in participating were able to take part in it. So they thanked us for being an amazing team, but we want to thank all the providers as well for being such great partners in this work, and we'll continue to reach out to providers to be able to schedule these so we can keep the work going and find out what individuals with IDD in North Carolina, what kind of employment interests they have, and as well as their family and guardians. So I just want to thank you all for participating, and we're looking forward to working with additional providers in North Carolina. And so with that, I will turn it over to Anita.
All right. Thank you, Yolanda, for that update. Everyone's probably wondering what happens next, right? So after the team at Work Together NC does all of these assessments, they get people who say yes to employment, which is really exciting news. And so, of course, once they say yes, we got to make some decisions about how to help them access competitive integrated employment at that point. And that is the purpose of our CIE liaison team. So next slide, please. We'll talk about that and what that looks like. Okay. So really, we are one amazing team that has come together. And I love that we have one team at the top because that wasn't always the way things worked. We have our assessments through Work Together NC, and you see that over there on the left-hand side of the slide. And this is where they complete the assessment. So once they do that, they give that information to our team, to our outreach team lead, who is Donna Rice at EIPD, and she accesses that information and coordinates with the whole team, which is and comprised of not only EIPD people, but our CRE coordinators from the LME MCO. So it's a real combined effort where our teams work together to try to support these individuals who may have more significant barriers to employment and need a little extra assistance with understanding what CIE means to them and how they can access it. So our teams, both our EIPD outreach teams and our CIE coordinators, work together. And you can see here on this slide exactly how they do that. For those who express interest in NCIE, they work with people to understand the assessments, they contact families and guardians, and they share information and resources with those members that the questions they may have before they are ready to take the leap and start working on employment. We're going to support them with getting access to EIPD and the referral process. So this team works together, which is really cool. You can see here, Donna, our team lead, looks at she's responsible for tracking the progress of the referrals that come in, and we have weekly triage meetings to look at what's going on, or actually I think it's biweekly now, but regular meetings to coordinate together, both the CIE coordinators who have information about, the members' plans, the guardian information, the name of the tailored care managers, and the list of services that person is receiving. And EIPD works with getting contacts with the local offices, getting them in, and that's just a path to getting people in to CIE, which is wonderful. So our team is great, and they work very hard. We have been working, alongside each other for a while now, and we're still learning as we go. We've had a lot of successes along the way, and I'm not sure if that data is on this slide or not. But I believe we have quite a few members who have not only got a referral to EIPD. I think of the ones from the Work Together NC assessments, we've had quite a few that have been referred, and of those, a good bit of them have moved on into having a case with EIPD, which is exciting. So that's really the team effort here. We're continuing to learn and grow together, and it's been an exciting process to move through, because before we weren't really working together as teams before the inclusion works process and all of this. So this is great to see, and we're continuing to streamline it and make improvements along the way. So that's really the story about CIE. If you have questions, I'll be glad to take those. Do we have another slide on this one? Oh, I think I got my slides out of order. So this is kind of like a referral of how the approach works. Is again, it's a joint effort, and you can see here I kind of touched on some of these things. Our team works together to talk to individuals who are interested in, who express their interest, to connect them and their families, any of their support networks, so that they can access CIE. And we're going to help them to apply for EIPD services and walk them step by step through the process to keep them connected, because often people in these situations have significant barriers and may not, it may need some assistance with staying connected in the process. And that's what this team can really do as an additional support to provide that extra level of support for these individuals to be able to more efficiently access CIE if that's their choice. So we're trying to make their choice to be in competitive integrated employment a reality, and this team is doing a great job. So hats off to them for their work. And I think, is that the last slide? All right, so I'm going to turn it back over to Yolanda, I believe, to talk a little bit more about Work Together and See.
Yes, thank you, Anita. So with Work Together and See, as Claire had mentioned, we have been supporting the work of the community engagement as well. So one of the things that we do is that we co-facilitate and co-lead the Inclusion Works Advisory Committee. So Claire touched a little bit about the community meetings. We also do an advisory committee meeting, which meets monthly. And in those monthly meetings, we have members that are provide different perspectives. So we have those with lived experience, we have employment providers, we have DHHS family members, advocates, researchers, tailored plans. We have a lot of different perspectives that are there. And in our monthly meetings, we spend time looking at the strategic plan, specific goals and strategies, and then thinking about how DHHS, how the state of North Carolina can go forward with those strategies. So what are some things that they're thinking about that are needs? So they're really helping to think about, how do we operationalize this plan? You know, we have these good strategies here, but what are going to be some of those next steps? And what are some things that the state needs to think about as they are implementing that plan? So we do have those meetings monthly. Another committee that we've been able to put together is the Transportation Alliance. That was one of the goals that was listed in the strategic plan, was to really ensure that we are looking at the transportation needs of individuals with IDD, since that was identified as a barrier when we did our landscape assessment at the start of the program. Excuse me, of the project. So again, we have members with varied experiences there and perspectives. They meet about every 6 weeks to really think about what are some additional barriers for individuals IDD, and then move into a problem-solving mode. What are resources and supports and next steps that can be taken to address those barriers? So we are also in the process of coming up with some additional resources that will be posted soon to support individuals with IDD as they are looking for employment, and ensuring that there are transportation services there for them. So these are just two of the things that we're doing. As Claire mentioned, we also support with creating the videos to go out to the public. We also support with the social media content that will be going out to the public. So it's a nice partnership where we're trying to come together, ensure that the community is aware of the great work of the Inclusion Works project, and ensure that we're also having feedback and input from the community in this process, so that we are meeting the needs of individuals with IDD, their families, their caregivers, employers, providers, that we're all coming together and ensuring that we are making more opportunities for competitive integrative employment in North Carolina. So just some of the things that we're currently working on. So with that, I will turn it over to Catherine to provide an update on what WISE is doing, who's also a partner in this work with Work Together and See.
Thanks, Yolanda. Hi, everyone. Good morning. Happy to be here and talk about what is happening with provider innovation. And so we'll talk. I'll remind you all, and some of you may be here who are part of the Provider Innovation Round 1, but as many of you probably saw over the past few months, applications for the Provider Innovation Round 2 were opened up and just closed less than a week ago. So the goal of the provider innovation work is to really support North Carolina providers to expand competitive integrative employment for their members. So that's often abbreviated as CIE. And yeah, the goal here is jobs and an expansiveness of opportunities for people with disabilities in North Carolina. So this work includes an organizational self-assessment, strategic plan work and a game plan, personalized training content through our WISE Learning Center, and the development of a Teams Pro site that the providers will use with their staff, ongoing technical assistance, and then there are milestone payments for being a part of the program. So we are in the process. By the end of this week, we'll start reviewing the applications that we received, and we've got a great team here with Inclusion Works who will be reviewing those together and determining. There will be 8 new providers beginning in the Provider Innovation Project Round 2 here by June. They will be starting with their first steps, I do believe. So we're really grateful for all of the applications, and we really look forward to the continuation of working together on that. And again, starting to really look at jobs. When it comes down to it, where are the jobs? Where are people working? What are the new opportunities that people have as a result of this work that we're doing together? So on the next slide, it's just a reminder of the 4 providers who are working really hard now. Vocational Opportunities of Cherokee, Allegheny County Group Homes, OE Enterprise, and Noose Enterprises. And when we talked about on that previous slide about the financial incentives, those are a part of the milestones that are on the bottom of the screen. So everyone has completed the first 3 milestones, developed their action plans and their training and TA plans, and all of the providers are well into the 4th milestone, and that will definitely be completed here by late spring, early summer. And where we're tracking where people are in the process of looking for getting a new job, including all the way thinking about discovery and planning and those first stages of job development that happen for a person. And I want to say some of the TA that's happened that we're really excited about, it's spanned everywhere from job development tips in rural areas and job development tips in larger than rural areas to communication plans. When all 4 of these providers are working really hard in talking with their boards, with staff, with the individuals in their programs who are job seekers or future job seekers, with the people who know and care about those job seekers. So the communication plans, all type of onboarding types of training, discovery training, there's all kinds of things happening through this provider innovation program. And we're really, it's exciting, and it's exciting because of course these 4 providers and the whole project, everyone's working really hard to transform what's possible for people. So on the next slide, Amy Miller, the CEO of OE Enterprise being one of the first four providers selected last spring, is Inclusion Works put together this video. So we're going to share this.
Hi, I'm Amy Miller. I'm the CEO of OE Enterprises, and we are a community rehab program here in North Carolina. We work with adults with disabilities that have intellectual and developmental disabilities. We've been in North Carolina for over 50 years now. We were started by a group of families that were wondering what was going to happen next to their loved one after graduation. So they started a work program here in Hillsborough. We've expanded our services over the years. We are now serving individuals in Orange County, Alamance County, Chatham County, Guilford County, and Durham County. And Asheboro, Randolph County. So it's really expanded. We have 3 meaningful day programs where we have individuals that come into our buildings and receive services. It might be activities, it might be work, they might be working here with us. And then we have our transition programs. We also have our supported employment programs. So we have a lot of services that we offer through OE. Our mission is to enhance the lives of individuals with disabilities through advocacy, education, and employment. And we embrace all 3 of those concepts, knowing that we are here to support our individuals by leaning into those 3 values. So choice is a huge piece. We want our individuals that we serve to have autonomy over their lives. So whatever that may be that they're retired, they've worked previously and they want to stop working, enjoy just a relaxing life. So we help support them in that manner. It might be employment. And what that employment might look like is how many hours they want to work, where they want to work, and in what environment, or with who they want to work. Whatever the individuals choose to do, we're going to provide them the supports that they need to be successful. So we were very, very excited when we saw this grant come across our table. We were like, this would be perfect for us to get some of our meaningful day participants that were previously earning a paycheck out in the community and earning a paycheck again. When we decided to apply, we were like, this is the perfect avenue and the perfect support where we can grow the vision of supporting our individuals with finding employment within the community. So when the Provider Innovation Grant funding has allowed us to really take an internal look at who we are as an organization and what our values are. And so we were able to examine the thought processes that our families have as far as can their loved one go out into the community to work. We saw a lot of families that were previously saying to us, I don't feel safe with them being out in the community. They're not going to be protected. So we were able to speak with the families. We were also able to look at our staff thinking and their mindset. And a lot of them were always thinking, oh, they can't do that. They're not able to do that. But we've had those conversations and started to switch that mindset. And it's been very exciting to see our staff really grow in that manner. And so this has been absolutely fantastic. We actually also took the opportunity to participate in the CIE assessments that were offered through the state. And we had 52 individuals take that assessment. And out of those 52, we had 22 that have been referred to EIPD services. And that was a major shift for us, because previously when we had talked to families about the possibility of competitive integrated employment, it was always that, no, can't do it. We can't do it because of benefits. We can't do it because of fear of them being safe. But we sat down and had one-on-one conversations with those caregivers, with those guardians, and they were all for it. And those assessments were fantastic. The group that came out and did them, we had parents or guardians that came and sat in, and they were very thrilled. And so we're excited to see where we're going next. And so it is going to be an awesome experience moving forward. Challenges really have been that mindset shift. So this, we realized early on that we needed to really look internally and take a deep dive and really feel out and be truthful with ourselves about what the thought process was, right? So that deep dive, and then it was also just what's the path forward? So where do we start? We knew we needed to go somewhere, we needed to move, but what's the first step? And so doing those assessments, having those conversations with those families was big, but it's also knowing that we can't instantaneously make this happen. There's no magic wand to change people's minds that quickly. And so this is not a sprint. It is a long race, and it's going to take us a while to shift, but we're committed to making that shift. Participating in the CIE assessments was a major first step. That was a major hurdle. And then we're speaking with our staff here in a couple of weeks. We're going to be meeting with them and talking to them about who is in their circle, who can they help connect us with within the community to help support our individuals to find jobs. So maybe their neighbor works at a bakery and we have an individual that wants to, learn to bake cakes. And so making those connections. So it really is looking at the person that we're serving, who surrounds them, what supports they have, and taking that action plan and just going step by step and really building upon it as we go. So the money that we're earning is going to be the capacity growing for our staff. We are actually going to be looking at adding some more additional roles within the organization. We're looking at doing some windmill training and getting some people certified so that we can actually support the employers out in the community as well. We're looking at how we can restructure and retrain our staff. We actually invested in a learning management system that has been huge as well to coincide with the CIE. So we're able to do more training around person-centered and what competitive and integrated employment looks like for our staff. So they have the knowledge to be able to be impactful in this mission. Do it. Just do it. It doesn't hurt to throw it in there. It's also look internally, look at your processes, look at the thought patterns that you have within your organization, and really see where you can grow. And know that there's at times been some negative connotation about competitive integrated employment, or can individuals go out and find those jobs. And it's knowing that it's still choice. There is still choice. I'm not saying that everyone has to go get a job. I'm not saying that they're all going to work 40 hours a week or anything like that. But give them that informed choice. Let them know that this is an option. Work is an option. And we can make it fit their situation or their needs or their desires or their goals, I should say. And so just apply. And there are those of us that came before you that will help you out along the way. I just want to say I'm very thankful that we were provided this opportunity to be able to participate as one of the 4 starting CRPs that were selected for the innovation funding, provider innovation funding. And I really am excited to see where we're going to go and where we're going to land.
So thanks for that, Amy. I know you're not here, but that was Amy said so much there without intentionally meaning to, but that really tied together what you've heard so far here. The ways in which the employment assessments and has tied into the work that with EIPD and the CIE liaisons and helping people start through that process and system with some of the TA and training through what has been offered through WISE and through the Provider Innovation Project. So Claire, I know you're back on screen, and I just want to say great work with your with the Inclusion Works work. It really is tying together. So the last thing I want to share about, and Tina has shared this flyer in the chat box for everyone. Along with some other training we're offering, have Inclusion Works has made available to folks in North Carolina. You do not have to be one of the provider innovation providers to take advantage of this core competency ACRE certified training. So our 100 series, this is a 4-part course. From the time you register, you have 16 weeks to complete the course. And there are options if you need a little extension, that type of thing. But this is self-paced. And Claire, you might want to talk about a few of the benefits here too.
Thank you, Catherine. Thank you so much. And thank you, as always, for the incredible work that WISE is doing to help transform the playing field for providers who are trying to provide employment services. It is making a tremendous difference. And this online academy series is also making a tremendous difference. And I do want to just add on to what Catherine was saying, that we currently have more than 30 people who have successfully taken and passed this course and who are now ACRE certified staff. There are many more people in the pipeline to achieve certification. It is hard work. And yet, when someone achieves this and becomes ACRE certified, this is a national certification. This is something we can do for the workforce in North Carolina that probably a lot of states don't do. We are asking and helping the people who provide employment services in the state to look at this as their career and build their skill set so that they become the people an agency wants to hire. It's a fantastic training. As I said, it's a national certification, and we do want to make sure that people who want to take this course can take this course. The state is willing to pay them to take this course. I also want to say, for those people who have become ACRE certified, we did not forget you, and your bonus cards are coming. We are working out kinks in our system, but it is coming, and it is coming soon. So you've been patient and you've done the work, and you're going to get rewarded for that. I also want to say that we're going to be making some changes to this in the coming year. One thing that is really important that we try to do always with Inclusion Works is to make sure that the initiatives, the plans that we come up with, that they're evaluated and they're reassessed on a regular basis. It's been an incredible year, and we want to make sure that as we move forward with this kind of an incentive program, that we make sure it is geared for success. So coming soon, stay tuned. You will hear more about what's going on with this series next year. We're going to be doing things a little bit differently. But I'm very happy to say that we can continue to offer this kind of training and support and workforce development for people in North Carolina. Next slide. So with that, I want to talk a little bit more about training opportunities and resources, the things that are happening now. And as we build, please remember that Disability 101 is out there. This has been a game changer. You can go on there. It is interactive. I like to go in and just put numbers in and see what it looks like. I actually did it with a person in my life the other day. We just went through and looked at it and looked at their specifics. It really does help get rid of some of the myths out there. We know, we always hear, I know I'll be heard all the time, if they go to work, they're going to lose their benefits. Use this as a tool and a resource, and then connect with a benefits counselor. But this is out there for you, and I'm so happy that North Carolina can provide this for you. Next slide. I always want to touch base on Inclusion Connects. This is the cross-divisional system that supports people with IDD. This has been incredibly hard work that people have put together, that our team has put together, to make sure that people have access to all their services, not just employment, but all their services, to be a one-stop shop for finding out where to go next, to act as a hub, to also give you some data points so that you can see where people are. So all people with IDD, regardless of skill, age, anything, they can choose where to live. They can choose who helps them achieve their goals. They can, we're trying to support, again, that direct support workforce. We're trying to make sure that we help them get the training and knowledge and skill base that they need so we can have one of the best workforces in the country. The goal of Inclusion Connects is to support people with IDD. One of the other ways we do that is to make sure that we are improving access to housing. People need safe places to live. They need places to live that are effective for them. You're going to see a lot of resources coming up in the next couple of years with very innovative things that the state is trying to help support. We're working very closely with LME partners on this, as well as service providers. And one additional thing that I think can't say enough about this is that many of you know that interpersonal violence is a problem for everyone. It is particularly a problem for those with IDD who can't always get access to the resources other people do. It's almost something that hasn't always been considered. And yet this is a very vulnerable population. And so there's a lot of work going on in this space. You'll see there's been some webinars last month, but continue to look at the site for these kinds of things. Inclusion Works is really proud to be a partner, to be part of the Inclusion Connects umbrella of services. Next slide. So we've got some training opportunities. And as I said before, we have the WISE Online Academy. We have the State Employment Leadership Network. We get seats in an e-learning course every year that we can send people to. It's incredibly effective. It's a great course. Nothing but positive feedback on those who have attended. So if you're interested in that, please reach out to me. APSE, North Carolina's APSE offers so many opportunities for employment and training that is there for you. We continue to have all the resources with Work Together NC, and we go to our conferences and we talk to the different stakeholders at those. We're going to be at NCARF next week. We're going to be doing some stuff at I2I in June. So stay tuned for those. Okay, and I think we are here for the Q&A at this point. Also, before we get to that, I just want to remind people that on this deck, we do have some QR codes for you to look at so that you can access all of the other things that we've got. We've got Lunch and Learns, we've got the website, we've got our mailing list, we've got the Work Together NC website with toolkits and other resources for both employees, employers, and providers. So let's do the Q&A. And let's see if there are any questions currently in our, I see one question so far. Is the ACRE certification for staff who work only with IDD population, or can staff who work with mental health and or substance use disorder populations apply? At this moment, the ACRE certification is for people who work with IDD. It's a really good question that you raise, and I think we might look at other avenues of ways that we can help staff who are working with other populations. But at this moment, this is for IDD staff. Good question. Thanks. Other questions, comments, concerns? Give you time to get those in. Okay. Well, if there are no more questions or comments, then we are so happy that you all came today, and we are glad that we were able to reach out and talk to you. We will thank you for the QR codes there. We are available to discuss things, to help solve problems, to work out solutions, and to find resources. So you can do all of that through some of these sites and connections. And my email is usually on the slide. I'm not sure. But you can always reach me as well. I think it's in the chat for today as well, that you can reach out to me through email. And with that, I will say have a great day. Oh, hang on, another question coming up. Okay, no, that one's one we answered. All right, then. I hope everybody has a great day and a great week. Thank you for coming, and we'll see you in a couple of months. Bye now. Latoya, back to you.
Thank you, Claire. The recording and presentation slides for today's event will be posted on the Inclusion Works website. The link is included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. The next Inclusion Works Community Advisory Committee meeting will be on Tuesday, July 21st at 11 o'clock. This concludes our webinar for today. Thank you for attending.